Welcome to The Breakdown with Dr. Earl, a mental health podcast. This is Dr. Earl Turner, a licensed psychologist and psychology professor in Los Angeles. Just a few disclaimers. The Breakdown podcast is not intended to replace working with a licensed mental health professional. Breakdown. Today's episode, I have joining me Patrice Nicole Douglas. She is a licensed marriage and family therapist based in Southern California, and she's also the owner of Empire Counseling and Consultation. She's an expert on issues among Black and Brown communities, and she has been featured in Cosmopolitan, Allure, Vice, as well as O Magazine and others. So thank you for joining me today, Patrice.
Thank you, Dr. Earl, for having me.
So I'm excited to talk with you today about Black men and boys and talk about depression and sort of what that looks like. But before we dive into that conversation, I just wanted to give you an opportunity to introduce yourself to the audience and tell them a little bit more about some of your work and the things that you're doing.
So yes, I'm a licensed marriage and family therapist in the state of California and Texas. I have Empire Counseling Consultation that is located in California, Texas, New York, and Florida now, where I specialize in men's issues, parenting, anger management, anxiety, depression, addiction, everything underneath the sun. I'm also a doctoral student at the Chicago School of Professional Psychology, where I'll be finishing up in a matter of a few months. A lot of my work is tailored towards the Black community, but as of maybe the last couple of years, it's been really honed in on Black men. I kind of got my start working with men in general at the clinic that I'm currently a director at, where I work with federal probation. And so I was doing drug testing, I was doing counseling, and pretty much all of my clients were male. So I've learned to adapt my skills and tools to help them when they're getting out of prison. And being that I am a Black woman, there was a lot of Black men that came in, and it just connected because I was the only Black therapist in the office. So over time, I started seeing them more. When I became a certified anger management specialist, a lot of Black men got referred to me to finish that for the courts. So even though this specialty didn't pick me, I picked it because it just blended very well. So to date, I haven't counted recently, but I think I've assisted over 175 Black men with either anger management, addiction, or mental health issues. So I am very, very grateful to be able to speak about that and educate others about Black men.
Yeah, and I think that's a really important topic, and one of the reasons I wanted to touch on this conversation, because we know in terms of understanding therapy that women are oftentimes more likely to seek help than men, and I think it's important for us as clinicians to really talk about these conversations at the broader level so that people can really understand, one, that there are people who specialize in working with people that look like you in terms of like the Black community, but also being able to spread awareness about identification and that we can actually provide services to address the concerns that they may be experiencing.
Absolutely. And as a doctoral student, of course, I have to do a dissertation, and my dissertation is on the barriers to mental health treatment for African American men. And the response that I got about why there's so many barriers and what's stopping them from going to treatment, even just getting them to participate in the study, was just, it was mind blowing to see the obstacles that they go through, just even hearing the word mental health and having to dive deeper into what that means for them and why they're not going to treatment and what can we do to help. I think even just participating in that study forever changed my life as a Black woman assisting Black men in my community.
Wow, and that's important. So I would definitely look forward to reading that.
Yes.
And best of luck with your research and your dissertation.
Thank you.
So before we talk more about sort of coping and what depression looks like in Black men, I just wanted to sort of get your perspective in terms of what are the core symptoms when we think about depression.
So when we think about depression in general, it's more about you're oversleeping, you're not eating, you feel very low, you have negative thoughts, you may be losing weight, you may be gaining weight from over emotional eating. Um, when you walk around, it feels like there's like a dark cloud over your head. Even sometimes with people with depression, their posture changes. It's just very low. And so when we look at that, we're looking for a sad person. a person that doesn't want to function, a person that is isolating themselves, they don't want to hang out with people, or they can be on the other side and they're working and they're, functioning in that way, but when they get home, they're a couch potato and they can't move. And so there's different layers as to why depression happens, but when we think about depression, we think of a sad person. So we're already not looking at depression for what it really can be.
hmm And I think that's a good point because oftentimes when we talk about depression, people will use like sadness and depression as meaning the same thing, and they're actually different. Like we all experience sadness at some point in our life, and oftentimes it might be related to some specific event. But for depression, that's a much different experience than what someone have when they actually just experience sadness.
Yes, because it can truly be a hormone chemical imbalance where nothing's going on in your life for you to be sad about, but for whatever reason in the makeup of, your hormones, there's just something there that's lacking. And that's where we may have to get into medications and things like that. But I really do believe, like you said, people think it's just sadness, and it's so much more to it. It's literally the inability to function. That's how bad it can get if it's not, treated.
Right. And so the conversation that I really wanted to touch on, as I stated, is more related to sort of how is depression different in men versus women. And so there's been a lot of discussions and research that has looked at sort of what these symptoms are. But I think oftentimes for the general public and also for some clinicians, there isn't this awareness that depression is experienced differently among men. And we'll get into a conversation more specifically about sort of what that is like for Black men. But in your own sort of clinical work and experience, what have been some of the things that you've seen in terms of how have the boys and men that you work with, what their symptoms look like?
So with the men that I've worked with, it's snappy. They're very snappy. Their moods are out of control and they get upset about the smallest things, and they know that it's super small. Like it could literally, I always use this example. It could literally be about Cheetos. Somebody ate the last Cheeto, but they really don't care about the Cheeto because they weren't thinking about that. But everything else that's been going on in their life, that Cheeto was their breaking point. So they're at work, they're doing what they're supposed to be doing, they're getting yelled at, they're working hard, and then they come home and everything that they're feeling, they take it right out on their family. And so when it comes to working with men, I always have to put an identity to what they're experiencing because they're just thinking like everybody around them doesn't understand where they're coming from. But it's way more than that. You're feeling upset for a reason. You're not feeling like yourself for a reason. You feel like nobody's understanding you for a reason because there's something going on. And so with men, they're very silent. You could literally ask them, "How are you doing?" and they'll say fine, and literally are having like Mortal Kombat in their brain. So it's like you really have to pull it out of them. You have to use their terminology. If you start using like sadness, hurt, they're gonna get defensive. They're like, "No, I ain't no sucker. I ain't no punk. I'm not sad. I'm just y'all irritating me." And it's more than that. So with men versus women, women are able to identify more of what they're feeling. Men don't understand that because they weren't taught to put words with how they're feeling. All they know is that they're a man, they got to make the money, they got to take care of the house, and that's it. Everything else outside of that is just part of being a man, and there's no time to talk about it.
hmm
So with men, depression gets easily missed amongst clinicians. They'll think like they're having a bipolar episode because their moods are up and down, or they may have an anger management issue because they're snapping at everybody. We're missing the core foundation of where that's coming from, and that's because they don't talk about it.
Yeah, that's a good point. I recall there was a study that was published maybe about 5 years or so ago by the American Medical Association, and it basically stated that approximately 30% of men that have a diagnosis of depression will exhibit some of those symptoms that you talked about in terms of like irritability and anger. And of course, the other piece of it is men are more likely to engage in risk-taking behaviors when it comes to unprotected sex or using substances. And so all of those things I think clinicians might miss or think that it's something else, and then they get misdiagnosed as opposed to being diagnosed with depression.
Absolutely. And so I'm from California, so I'm from the Kush state. And so everybody is, men especially draw themselves to marijuana. That's how they, that's how they decompress. If they don't have their marijuana, and when I'm not generalizing for all men, but the men that do, when they don't have their marijuana, it's like they literally are having a hard time balancing their emotions. And so that is a telltale sign, working in addiction and working with men, that substance abuse is the number one sign of there may be some type of emotional issue going on, especially if they're mixing a lot or they don't care about what amounts they're taking. Now we're getting into, you're more hopeless, you have some suicidation because you know you're doing something that you're not supposed to be doing, but you don't care.
Hmm.
So I absolutely agree that substance abuse and risky behaviors is one, as well as sexual dysfunction is another one in men, where if they're not feeling like themselves, they're not able to get an erection, and if they're not able to get an erection, that brings it right back to the depression of like, now I can't please my wife, now I feel less than a man. So it's just a really bad domino effect if men don't get their depression treated.
Hmm. And those also, that also ties back to that idea about sort of masculinity and sort of what the norms are. So you mentioned how for men being able to talk about emotions or feel comfortable to talking about emotions might also make it much more difficult for them to seek help or to be able to disclose certain things in therapy or to engage with the therapist because the therapist is sort of using that emotional language which they're not
Yes.
prepared to talk about. So I always talk about how when you're working with therapy with men specifically, that as a clinician, it is necessary to make sure that one, you use their language as you sort of mentioned, but also you have to really meet them where they are, and you can't really push too soon because then they're going to completely shut down.
They are going to shut down, especially if they feel like you're trying to label them. Men are very afraid of labels. And I mean, we can even take it to the black and brown communities. Labels are very offensive. And so if you're trying to say that something's wrong with them, they're going to run away, or they're going to defend themselves instead of taking it as feedback or concern that they should address certain things. So yes, when it comes to men, there's definitely a sensitivity piece that needs to be in place, and using more of their language. It's That's just more important, instead of using the DSM or using, the clinical keywords that we know that's going to go right over their heads, and they're going to think that you're trying to hypnotize them or whatever the case may be. So using their language and getting to know them instead of rushing to put a label on it, hear them out. And so when you finally come to your conclusion of, hey, this looks like depression, you're able to literally give examples of why the symptoms meet their criteria by the examples they gave you. So it's very, very important to have active listening when it comes to men, because they're paying attention. They definitely do.
And I actually was just having a conversation with my students in class about that, in that we can't just go through this DSM as sort of this checkbox system given a diagnosis. And I think, as you sort of highlighted, for men doing that means like, well, one, you're not listening to me. I'm not depressed. I don't look like the things that you're talking about. But I think then that if you contextualize things as you mentioned, hear them out, then you can be able to say, well, this is sort of what depression looks like in men. These are the things that you've talked about. This really sort of fits that category. And also explaining how this label is helpful for you to get treatment and to get services, not just to say that this is who you are as a person, but you're struggling for a number of reasons that may have resulted in you experiencing depression at that moment. So I think those things are really important to get at the heart about really what we in our sort of roles hope to do is really helping people to live their best life. And so
Absolutely.
you have to make sure that you get the appropriate support to be able to address those concerns.
Absolutely. We got to give them the buy-in. It's the
Mhm.
buy-in that matters.
Right. So one thing that I think, both of us are very involved in terms of social media and sort of engaging people and the public. And I, for one, think that that is very helpful to address some of the stigma around treatment and really personalize, I think, for therapists, that there are different therapists that are out there and not everyone sort of, sits on the couch and looks a certain way. I think that's helpful. But from your own sort of experience, sort of how do you think that that's helpful for men specifically to encourage them to seek out therapy, because we know that oftentimes it is seen as, therapy is not for men, it's more for women to be able to do that.
I think removing the whole label of therapy is meant for people with mental health issues Because as we know, of course, when we look at therapy from a clinical perspective, whether it's, insurance or not, sometimes the person that's coming in, due to the circumstances of what they're coming in, we may have to put a label automatically. And I talk about insurance and reimbursement and all that. Then you have some people that just want to come and, they're doing all right, but they could do better, and they just want some coping skills, and just to make sure that the way that they're handling situations is appropriate. So they come to therapy. They don't really have any type of mental health disorders per se. When we talk about therapists for men, that's exactly where their brain goes. You trying to say I'm crazy? I'm not. I'm having a bad day. So I believe that if we could break the stigma surrounding therapists, psychologists, whoever, that we're more than just treating mental illnesses. We do career development. We do sometimes therapists have life coaching certifications or abilities. So making sure that they can take their personal lives to the next level, or just making sure that they have coping skills, or giving insight about how they can do better in their relationships. None of that entails you have a mental illness. It just means that you're looking for somebody that has the background, the experience, and the education to provide things that can make your life better overall. And I think that when we take therapists out of that box for men, especially Black men, they're more inclined to come see you, because I get it all the time, and it came up in my study. Well, if I'm in a relationship, I'll go to couples counseling with my girl, because it's an us problem. It's not a me problem. But if you're trying to send me to therapy, it's a me problem, and there's nothing wrong with me. I'll keep talking to my boys. I'll do whatever, but I don't got an issue. But if I tell you, like, oh, what if I could help you with your girl? Y'all bickering back and forth. Let me give you some tools so that you could cut the conversation in half. I bet you any money those men would be lined up outside my door. So if we change up what therapists do, and maybe expand more of what we're able to do, then I think men will be more inclined to come see us. But unfortunately, we have the Freudian concept of, you got to go lay on the couch and close your eyes, and I'm going to like read your mind. That's totally not what I'm going to do. There are analysts out there that are about that life, but all of us aren't. And so I'm not. So no, you're gonna sit on my comfy couch, and you're going to vibe out to my aromatherapy candle, and we're just gonna shoot it up about life. That's what it's about, and I'm just gonna help you figure out some things. And so it's the buy-in of getting them into the office. Once they're in the office, they don't want to get off the couch.
Yeah, so one thing that you sort of touched on is that it's important to sort of change the perceptions about what therapy is and what type of people go to therapy. And so I'm wondering, like, what would you recommend as a way to really start a conversation with a man, or specifically a Black man, about encouraging him to go to therapy without making it seem like you're thinking that he's crazy or like something is wrong with him? Like, what might be some tips that you can offer for people, like if you have your friends, or if you're dating someone and you want to tell your boyfriend, like, maybe go talk to somebody, what can this conversation look like?
Well, I always start off my conversation, especially like in public settings where men come up to me like, you're a therapist. You're already reading my mind. I just look at them and I say, hey, you're a Black man, right? And they say, yeah. I said, so how has life been for you? It's been a challenge. It's been, everybody's judging me. Everybody, wants a piece of me, or, I'm afraid to go outside at times, or I'm sleeping with the gun underneath my pillow because of A, B, and C. And I said, so who told you that was normal? And they'll tell me like, well, my homeboys do it, and this. I'm like, so how do you feel about living that life? Honestly, it sucks. I'm overwhelmed at times. I said, and that's why you need to come sit on this couch, because I'm not going to say that you have a problem, but the fact that you don't like the way that you're living life right now, I can help you out with that. And they're like, oh, word. I said, yeah, that's literally what it is. Like, you just told me that you walk around with a target on your back. Just being a man of color in itself, you already got people judging you to the point where you feel like your safety is in question based off of whatever happened in your background, and you hate sleeping with a gun. So why wouldn't I help you get rid of that gun underneath your pillow? So I literally reframe what they just told me, because they're gonna tell me like, oh, life is this, life is that, women be tripping. I'm like, oh, women be tripping. I could probably give you some insight about why women be tripping, or maybe it's you tripping. And let me tell you how to reframe your words so that the girls won't be tripping. So it's literally just making it everyday lingo. Because if he was to say the same thing about not being able to sleep without the gun underneath his pillow, and that he feels like he has a target on his back, oh my gosh, well, you sound like you're very anxious. You have probably anxiety or PTSD. And like, whoa, 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 ain't nobody got trauma over here. Ain't nobody doing all that. So you got to just be very careful. So if I can just show you that I can help you with a little bit of your life, the rest is it. Because out of all my clients, men are the most loyal, and they come consistently, because once they get to talking and they realize that it's a conversation where I'm not judging you, I'm not telling you how to live your life, I'm literally all about you, you ain't gonna see me outside a session, they're able to let their guard down. And I know they don't like this word, vulnerability, they're able to be vulnerable. So I think it's just all about having that pure conversation and just getting to know them.
Mhm.
That's the key.
Yeah, and you touched on a really good point that I've sort of stated myself at times, is that we have these perceptions about men and who we are, and we get placed in a box about sort of um, being vulnerable in certain spaces. And I think that all men have the potential to do that. It's about, do they feel safe? And I think that oftentimes when they come to therapy, is that they don't feel safe, and that the clinician is oftentimes judging them before they even open their mouth. And so, of course, I'm not going to come into your room and sit on your couch and be vulnerable and open up about myself. And so I think you do have to sort of start to develop that relationship as a therapist to make sure that they feel safe. And I think for women in their lives or their homeboys or friends, is that you have to make sure that you have those conversations like you just mentioned about, maybe talking to someone won't be bad. You can sort of get out some of this stuff where, like, that's your space, that's your time. It's all kept within that room, as opposed to you sort of disclosing things to people who might judge you based upon the experiences that you've had.
Absolutely. And I think there's also a stigma about what therapists are, that we're stuffy, we're stuck up, and all we do is nod our head. But if you come into my office, especially if it's on a Saturday, I'm rocking my J's, I'm rocking my Fashion Nova jumpsuits. I'm like, hey, what's going on? Let's talk about it. It's more of like a, hey, I can relate to you because you look like a human being that I would see every day, or a sister that's in my community, in my space. And so I think just having that stereotype of what therapists look like, I don't think I fit that mold. And so I'm able to break that stigma of like, we all look different, we all approach things different, and our style is very different. And so mine is very, I guess in the clinical sense, client centered. I let you lead the session, and we just talk about whatever you need to talk about. I don't have a specific structure. And so I think that's helpful too.
Yeah, I agree. And I think for me, I really appreciate social media and therapists that are on social media that are sharing information about sort of signs and symptoms of different disorders, but also they show up and be authentic. And I think that for me, I've always talked about for the Black community specifically, is that one thing that we can do is that we can tell if you're authentic or not.
Yes.
I go to your therapy office and you're saying all of these things to me and you're not being yourself, then I'm not going to feel like I'm comfortable in this space. And I think that even for people who decide to wear suits, or if a Black female therapist wants to dress in a nice blouse, like, if you're authentic, they're going to develop their relationship with you. It's not about sort of the way that you dress. Be yourself. And I
Be
think that's
yourself.
something that you sort of touched
Absolutely. So just be yourself, therapist.
on. So before we wrap up, I wanted to just sort of touch briefly on, when we talk about sort of depression and other mental health disorders, that there are ways that you can sort of cope with things just to sort of help you get through the day. And obviously for some people, things are much more serious and you do need to seek out help, because that's important because of the severity of what you're dealing with. But I wanted to know from your sort of experience, if there could be like one or two things that you can maybe suggest for people that may be starting to like feel a little bit depressed based upon they've been dealing with some sort of life challenge for a long time, or you haven't been working and you're starting to feel a certain way. What are some of the things that you would suggest in terms of coping strategies, or signs that you should go see someone in terms of a therapist?
So my answer is always, everybody should see a therapist. I think therapists should definitely see a therapist. All of us could use a therapist in our life. I think when it gets to a place where you're not able to function. So if you find yourself having more negative thoughts about like life isn't getting any better, then it turns into, what would it look like if I'm not here? Or you're hoping that, if you drink all this alcohol or you're taking all these drugs, if you don't wake up, you'll be okay with it. That's not normal thinking, because what we do know about suicide ideation and suicide in general is that most people that try to die by suicide are trying to end the pain. They're not trying to really end their life. And so there's a point where we can try to save you from those thoughts by getting you some help. So if you find yourself being overwhelmed with certain things, I would say first of all, meditation and yoga is helpful, and there's a lot of different Instagram pages and social media pages out there that are focused on men and yoga, as well as talking to someone, talking to your boys about it. Open up the conversation a little bit more, allowing them to tap in a little bit more for you. One of the things that I've learned in my dissertation research is that more men would like to have conversations amongst themselves about issues and not just be doing surface conversations. If you find yourself being overwhelmed, maybe you need to go get a physical at the doctor. Sometimes it's a hormone, it's a chemical thing. And so maybe it's time to get that physical and get that blood work done just to make sure that everything's okay. But the key to identifying what's going on with you, or trying to reduce the symptoms, is letting it out. So if you want to journal, if you don't like to write, do a voice memo in your phone, talk to somebody. That's going to be the key in taking it out of your mind where it's just circling so much you can't think straight. And it's actually going to make sense when you write it down or you talk to somebody about it and you feel a sense of relief, or you realize there's more and you need to talk to somebody about it. So for men, it's more about open your mouth or hand and write it down.
Great. Those are good points. And I think one thing that you touched on is that, therapy is helpful to address those concerns. And we know that in terms of the research that 80% of the time therapy is effective. Obviously, that other small percent of the time, it might not be effective because maybe you're not doing the strategies that the therapist recommended for you to do. Maybe the therapist hasn't sort of used the appropriate intervention or treatment.
Yes.
So those things might impact that as well. But we do know that if you're engaging in the therapy and you have a therapist who's trained effectively to address these concerns, that it is effective. It can help you develop better skills. It can help you to be able to, again, navigate those life challenges that may sort of stress you out and overwhelm you. And it can help you to be able to identify what are the ways to improve those relationships. And so I think all of those things are really important for people to keep in mind.
Absolutely.
So before we wrap up today, I wanted to give you an opportunity to let the audience know where they can connect with you on social media, and I'll be sure to include this in the show notes as well.
Yes, so I am on all social media platforms. Twitter and Instagram is my favorite. So if you're on Instagram, follow me at the Patrice Nicole. If you want to find me on Facebook and Twitter, it's Patrice N. Douglas. You can always email me at patricenddouglas@gmail.com. I am very active on social media and the internet, and I'm always open to questions. Of course, I can't be your therapist and I can't give you advice. But if you have questions about finding a therapist or what to look for in a therapist or anything of that nature, hit me up. I'm very approachable, and I love when people DM me about questions like that.
Great. Well, thank you again for tuning in to The Breakdown with Dr. Earl. Be sure to follow the show on Instagram at The Breakdown with Dr. Earl. And thank you again, Patrice, for joining me today.
Thank you, Dr. Earl.